Most seniors I see in my neurology clinic are doing everything right during the day. They're watching what they eat, they're taking their medications, some are even exercising, and yet they come in with worsening memory fog, slower thinking, and a kind of mental fatigue that a full night's sleep never seems to fix. Here is what I tell them, and what I want to tell you right now. The danger isn't only happening during the day. Some of the most significant damage to your brain may be happening at night, in the dark, while you believe you are resting safely. It is about what position your body is in while you sleep, because that determines whether your brain spends the night cleaning itself or slowly filling with the toxic proteins linked to Alzheimer's and cognitive decline. Your brain has a cleaning crew. Most seniors are accidentally shutting it down every single night without knowing it. By the end of this video, you will know exactly which position is quietly putting your brain at risk, why the biology works the way it does, and the one adjustment you can make tonight that changes what happens inside your skull while you sleep. Your brain has a cleaning system. It is called the glymphatic system. And here is how it works. During the day, your brain generates metabolic waste, proteins called amyloid and tau. These are the same proteins that, when they build up over years, form the plaques and tangles we see in Alzheimer's disease. Your brain cannot efficiently clear them while you are awake, so it waits. When you enter deep sleep, specifically stage 3, what we call slow-wave sleep, the spaces between your brain cells expand by roughly 60%. Cerebrospinal fluid floods in through tiny channels and physically flushes those toxic proteins out of your brain tissue and away. During this stage, your brain's waste clearance runs at roughly 80 to 90% greater capacity than when you are awake. That is the difference between a clean brain and one that is slowly accumulating the raw material for neurodegeneration. Now here is where age becomes a critical factor. After 60, the glymphatic system becomes measurably less efficient on its own. The channels narrow, the fluid dynamics slow. Your brain's cleaning window gets shorter with every passing year. That means the cleanup your brain gets each night matters more now than it ever did when you were younger. You cannot afford to waste it. I sat across from a patient some time ago, a woman in her late 60s, who had progressive word-finding difficulty and that heavy, unrefreshed feeling every morning despite sleeping 7 or 8 hours. Her sleep study revealed something specific. She was spending almost no time in stage 3 deep sleep. The cleaning crew was showing up, but the conditions weren't right for it to work. And the reason those conditions were wrong had everything to do with how she was sleeping. Not how long, how. So now the question becomes, what is most seniors' sleep position doing to that process? And when I tell you, you may realize this has been happening to you for a very long time. I want to be direct with you here, because this is the part most health content softens or buries. I am not going to do that. The sleep position most associated with impaired glymphatic waste clearance, the position linked in observational research to higher rates of Alzheimer's disease, Parkinson's spectrum disorders, and mild cognitive impairment, is sleeping flat on your back. Not stomach sleeping, not side sleeping, back sleeping. The position most people consider neutral. The position many doctors have historically called the safest for spinal alignment. The position you may have been told is perfectly fine. For your spine, it may well be. For your brain's nightly cleaning process, the evidence is pointing in a different direction. Here is what happens mechanically when you lie flat on your back. First, the tongue and soft tissue at the back of your throat fall backward under gravity. This narrows your airway. Even if you do not have diagnosed sleep apnea, This partial obstruction fragments your breathing throughout the night. And fragmented breathing means fragmented sleep, which means less time in the deep slow wave stage where the glymphatic flush actually occurs. Second, venous drainage from your brain to your heart becomes less efficient in the flat supine position. Think of it this way. The fluid system that clears waste from your brain depends on a pressure gradient. Fluid in, waste out. When that drainage pathway is compromised by your posture, the outflow slows. The cleaning crew can't move the trash to the door. Research presented at the Alzheimer's Association International Conference found a striking pattern. People with Alzheimer's disease, Parkinson's spectrum disorders, and mild cognitive impairment all spent significantly more than 2 hours per night on their backs. And this association held even after researchers accounted for age, sex, and sleep apnea. The number that kept appearing in the data was 2 hours. More than 2 hours of supine sleep per night was the threshold associated with meaningfully elevated neurodegeneration risk. Now, I want to address something directly, because I know what some of you are thinking. You have slept on your back your entire life. You feel fine. Nothing hurts. So how could it possibly be a problem? Here is the honest answer. The brain does not send you a pain signal when it is accumulating toxic proteins. There is no alarm, no warning light. Cognitive decline develops silently over years and decades, and by the time symptoms appear, the memory lapses, the word-finding difficulty, the processing slowness, the accumulation has been building for a long time. The absence of obvious symptoms right now is not evidence that the biology isn't happening. The habit of a lifetime does not make it safe, it just makes it familiar. Now, I also want to be clear about who faces the highest immediate risk. If you wake up with morning headaches, feel unrefreshed despite a full night of sleep, have been told by a partner that you snore heavily or stop breathing, or if you experience daytime cognitive fog that lifts slowly, these are not minor inconveniences. These are signs that your brain is not completing its nightly maintenance cycle. The glymphatic flush is being interrupted repeatedly, every single night. And if back sleeping is compounding sleep apnea, that compounds the problem further still. Because every apnea event fragments the deep sleep your brain needs most. So if back sleeping is the risk, what is the solution? And why is the answer more specific than simply telling you to roll onto your side? Let me resolve this directly, because there is conflicting information out there, and you deserve a clear answer. Both left side and right side sleeping are significantly better than back sleeping for glymphatic waste clearance. The research on lateral sleep positions, in both animal models and emerging human studies, consistently shows that lying on your side allows the cerebrospinal fluid pathways to function more efficiently. The drainage improves. The pressure dynamics work in the right direction. The cleaning crew can actually do its job. So yes, either side is better than your back. But for seniors specifically, left side sleeping carries additional advantages that make it the preferred recommendation. Here is why. When you lie on your left side, stomach acid stays below the level of your esophagus. That matters enormously because acid reflux is extremely common after 60, and reflux fragments sleep just as effectively as sleep apnea does, burning the throat, triggering microarousals, pulling you out of the deep sleep stages your brain depends on. Left side sleeping keeps the stomach positioned below the esophageal junction, using gravity to hold the acid where it belongs. Additionally, on your left side, lymphatic drainage flows more freely toward the thoracic duct. And while the heart pumps efficiently from either side, left side positioning reduces a small but meaningful amount of gravitational resistance on circulation. All of these factors, acid control, lymphatic flow, circulatory ease, compound into longer, deeper, less interrupted sleep. And longer, deeper sleep means more time in stage 3, which means more glymphatic flushing. Now, the gold standard for seniors, the setup I recommend most often in my neurology clinic, is what I call the supported left side lateral recline. It is not complicated, but the details matter. But first, the setup. You want a slight elevation of the upper body combined with left side positioning. Think somewhere between 15 and 30 degrees of incline. This keeps your airway open, reduces apnea events, controls reflux, and maintains the lateral fluid dynamics the glymphatic system depends on. A firm wedge pillow under the mattress or an adjustable bed base achieves this incline without forcing you to sleep propped up on stacked pillows, which tends to collapse during the night. A pillow between your knees keeps the pelvis neutral and takes strain off the lower back. This is important because hip and back discomfort is one of the main reasons seniors abandon side sleeping after a few nights. And a supportive neck pillow, one that keeps your spine in a straight line from your head to your hips, prevents the neck craning that causes stiffness and makes people give up on the position entirely. I worked with a man in his mid-70s who had been sleeping on his back for decades. He came to me with progressive word-finding difficulty and that heavy morning fatigue that no amount of sleep seemed to fix. After transitioning to supported left-side sleeping with a wedge pillow setup over several weeks, his sleep quality improved measurably, and his morning clarity, his own words, came back in a way he had not expected from something as simple as a pillow change. Now, one important modification note, because I know some of you have conditions that make this complicated. If you have severe shoulder bursitis, rotator cuff damage, or spinal stenosis that makes side sleeping genuinely painful, do not force this position. Sleeping through pain is not the answer. Instead, elevate the head of your bed by at least 6 inches using a wedge placed under the mattress itself. This improves venous drainage from the brain and reduces airway collapse even from a back sleeping position, and it is meaningfully better than lying completely flat. It is not the ideal, but it is a real and significant improvement. Getting into the right position is the foundation. But here is something most people do not expect. Some people make every change I just described, the wedge, the left side, the pillow between their knees, and still wake up foggy, still unrefreshed, still slow in the mornings. And the reason has nothing to do with their position. It has to do with what is quietly dismantling their deep sleep before the glymphatic system ever gets its chance. So let's say you make the change tonight. You set up the wedge pillow. You position yourself on your left side. You do everything right. Here is what I need you to understand. Position is the container, but sleep depth is the fuel. And without deep, slow-wave sleep, the glymphatic system cannot complete its work, no matter how perfectly you are positioned. Think of it this way. You could have the cleanest, most efficient drainage system in the world, but if the water pressure is off, the pipes run slow. Position opens the door. Deep sleep is what actually runs the process. So let me tell you about the 3 most common things seniors do that quietly collapse the deep sleep their brain depends on. The first is alcohol within 3 hours of bedtime. A glass of wine in the evening feels like relaxation, and alcohol does help you fall asleep faster. But it specifically suppresses slow-wave sleep, the exact stage where glymphatic flushing peaks. You may sleep 8 hours without waking once, but if alcohol is in your system, your brain cycles through lighter stages and misses the deep clean entirely. If you are using alcohol to wind down before bed, your brain is paying for that habit every single night. The second disruptor is irregular sleep and wake times. The deep, slow-wave cycles that drive glymphatic activity dominate the first half of the night. If your bedtime shifts by 2 hours on weekends, you are not just losing sleep, you are shifting the entire cleaning window. My directive to patients is specific. Choose a sleep time and a wake time and hold them 7 days a week. Your brain's maintenance schedule does not recognize weekends. The third disruptor is untreated sleep apnea. If apnea events are fragmenting your sleep every few minutes, deep, slow-wave sleep never consolidates and the glymphatic flush never reaches full capacity. You can have the perfect position and the perfect bedtime and still spend years with a brain that is not clearing its waste. Treating sleep apnea after 60 is not a comfort measure. It is one of the most direct neurological interventions available to you. But here is what I need you to understand before we talk about what to actually do tonight. Knowing the problem and fixing it are two very different things, and the gap between them is where most people stay stuck. So let me bring this together into something you can act on. 3 things: position, depth, and airway. That is the framework. For position, move to left side lateral sleeping with a wedge pillow elevating your upper body 15 to 30 degrees. Add a pillow between your knees to protect your pelvis and lower back. Use a neck pillow that keeps your spine aligned. If shoulder or spinal pain makes side sleeping impossible, elevate the head of your bed by 6 inches using a wedge under the mattress. That single change improves venous drainage from your brain, even from a back position. It is not perfect, but it is genuinely better than lying completely flat. For depth, remove the 3 disruptors. Stop drinking alcohol within 3 hours of bed. Lock in a consistent sleep and wake time and hold it 7 days a week. Not most days, every day. And if you are using caffeine in the afternoon, understand that it compresses the deep sleep window that opens in the early part of the night. These are not soft suggestions. They are the conditions your brain needs to run its cleaning cycle. For airway, take the warning signs seriously. Waking with morning headaches, feeling unrefreshed after a full night, snoring, or a partner observing pauses in your breathing. These are not normal aging. They require evaluation. A sleep study is a straightforward test, and treating sleep apnea is one of the most direct things you can do for your brain's long-term health after 60. Now, most people need 2 to 4 weeks before a new sleep position starts feeling natural. That is normal. The discomfort in the first week is not a sign the position is wrong. It is a sign your body is adapting to something it has not done before. Give it time, keep the pillow setup consistent, and the adjustment will come. But I want to be honest with you about something else. There are symptoms that go beyond what a pillow change can address. If you are waking with confusion that takes more than a few minutes to fully clear, if you are forgetting conversations from earlier the same day, if word-finding difficulty is getting progressively worse over weeks and months, those are not signs of poor sleep hygiene. Those require a medical assessment. Not eventually, soon. Lighter sleep, more nighttime waking, and earlier morning rising are common in older adults and generally not alarming on their own. But unrefreshed waking, morning headaches, and persistent daytime cognitive fog are signs that your brain is not completing its nightly maintenance. That distinction matters, and I want you to hold on to it. You have just changed something real about what happens inside your brain tonight. But here is what I need you to stay with for one more moment. Because there is something else that can happen during sleep that no pillow arrangement will protect you from. And most seniors have no idea what to do when it starts. There is one more thing I want to leave you with, and it connects directly to everything we have just covered. Better sleep means more blood flow to the brain, less inflammation, lower overnight blood pressure, a nervous system that is actually recovering during the night instead of straining. All of that is genuinely protective. But it also means your brain is more active, more connected, and more dependent on that circulation being clean and uninterrupted. And that is exactly why I want you to watch the next video before you do anything else. It covers what to do in the first 3 minutes of a stroke. Not in a hospital, not with a doctor present, but in the moment it begins, wherever you happen to be. A stroke does not announce itself. It begins quietly. And what you do in those first 3 minutes determines most of what comes after. Most people freeze. They wait. They assume it will pass. That window closes fast. You have just made a decision to protect your brain during sleep. That next video is what you need to protect it when you are awake. Before you go, drop a comment below telling me what position you have been sleeping in. I read every one, and what you share helps people in this community who are dealing with exactly the same thing. It is on your screen now. Watch it next.